Hi, I'm Lisa Yen. I'm the Director of Programs and Outreach for LACNETS, and I'm here with surgical oncologist and NET expert, Dr. Alexandra Gangi, who's at Cedars-Sinai Medical Center. So, Dr. Gangi, I'd love to ask you, a lot of times people who are newly diagnosed with neuroendocrine tumor always wonder who they should go to, and we often encourage them to see a NET expert. And why would you also encourage them to see a neuroendocrine tumor expert?
Hi, Lisa. Thank you for being here and asking me these important questions today. I anticipate there's going to be more than one. That's why I'm saying questions. But neuroendocrine tumors, as you know, and as many of the followers who are seeing this probably know at this point, they're rare types of tumors. So although we know a lot about them, and it's one of the tumors that I treat, a lot of times providers out in the community may have only heard about them while they were in training or have treated one or two. And so they're very nuanced in terms of the way they should be managed. And so the main reason that it would be important for a patient to go see a NET expert who treats primarily patients with neuroendocrine tumors, just because there's a lot of changes that have happened from the time that maybe these other providers had treated a patient with a neuroendocrine tumor. There might be additional options, whether they're surgical, medical, clinical trial options, things of that variety that they may not necessarily be aware of. A lot of the times I know a limitation for patients is sometimes it's difficult or out of the way for them to go to a particular institution or location where NET experts may exist. But what we try to do is help to educate the patient so that they can understand their options, because a lot of times there's more than one really good option, to discuss kind of the sequence in which the different treatment options may need to happen, or how we would want to consider them to follow one another. And then we typically can work with your local providers to make sure that you get the treatment or the therapy you need, and sometimes provide guidance to them. For example, sometimes that means they're planning on giving you chemotherapy and there's no chemotherapy that you should be getting. And so sometimes we can have a conversation suggesting kind of a change in the treatment algorithm, and then that'll benefit both you and your treating physician in kind of managing future patients.
That's really helpful. You know, it's challenging, if people are driving really far, as you said, and they might wonder what's the difference between having surgery with you, for example, and having surgery locally? Isn't it the same surgery?
Although I'm sure that the local surgeons are equally, if not more skilled than some of us here. I think again, it comes down to the nuance of specifically what we're managing, right? So surgery for neuroendocrine tumors is a little bit different than surgery for every other type of cancer. And we tend to be a lot more aggressive with patients with neuroendocrine tumors because the prognosis is a lot better. So just the question of cytoreductive surgery, meaning patients with metastatic disease, how aggressive should we be with taking out primary tumors in addition to, let's say, 43 liver metastases? That would be unheard of in a lot of other spaces other than neuroendocrine tumors. And so there might be different approaches that someone at an expert center would take, even with respect to surgery. In addition to that, given that a lot of times patients have functional tumors, or at least carcinoid syndrome, having an appropriate anesthesia team and medical team that's available to kind of manage any potential complications that can arise, or at least is comfortable with the idea of that, is of critical importance. So it's not just the surgeon; it's the whole team. Just making sure that we have the right people available should any type of additional problem arise. Those are things that you're not always going to get with your local treatment team.
That's such a good point. It's not just one doctor, it's a multidisciplinary team. So again, for on the patient's end, the concern is, well, what if I need to see multiple doctors? What do I do? And is there something I can do to help educate community doctors so that they learn about neuroendocrine tumors and I don't have to drive hundreds or thousands of miles to see a NET expert?
Yeah, interesting that you would ask that question, given given what you do on a daily basis. So I think education is paramount both for patients and for providers. I think the mission for all of us is really to make sure that patients feel empowered, and then that the local treating physicians feel comfortable. A lot of times that's the other problem, is a treating physician might say, I don't know, I've only seen one of these things. And so we want to make it so that we have a working relationship with them and can provide additional information. As you know, there's numerous websites, support groups, et cetera, where there's information for patients and also for doctors. NANET certainly has different regional education approaches. We hope to have one in Southern California in spring of 2025, so be on the lookout for that. So that'll be a good experience for local providers to come by and kind of learn more. We hope to also have a patient education session there. In terms of driving to have to see multiple doctors at multiple different appointments, there are some institutions, Cedars included, that do essentially a multidisciplinary clinic where essentially you could do a one-day visit to that particular institution and see everyone from the team who might be involved in your treatment. So that would include a surgical consultation, an oncology consultation, nutritional support, supportive care services, occasionally nuclear medicine, endocrinology. So it's kind of a long day for the patient, but really beneficial, especially if you're going to be making that drive from afar. And that's usually coupled also with a same-day tumor board where all of us meet and discuss the options for your particular diagnosis prior to meeting with you, so that we kind of have a comprehensive plan. And sometimes if you need imaging on the same day, we're able to do things like that. So Cedars is the only institution I know of in California currently that's doing this, but there are other institutions like Iowa who do have kind of these multidisciplinary clinics, and I'm sure they'll become more prevalent, but that's one option. And then another is certainly if you're within the state and it's difficult for you to get here, we do generally want to see patients in person at least once, especially if we're talking about surgery. But virtual visits, meaning via telephone or video, are also always an option. So you don't always have to make the drive to speak with an expert, and then we would be happy to work with your local team.
Thank you so much. Thank you for really the patient-centric approach that you have with that clinic and being willing to work with community providers and also working to educate community providers. We really look forward to the NANETS educational event next year to continue to do that work.
Yeah.
And really thank you for all you do on behalf of the NET patient community.
Thank you very much for trusting us to do the work.
Thank you.